Bones, muscles, and joints give the body shape, allow movement, and protect vital internal organs. Long bones form the upper and lower parts of each limb. Muscles, ligaments, and tendons attach to the bones, allowing for movement where the bones come together at joints. These bones are the most exposed to external forces and injury. There are 4 different types of injuries affecting bones, muscles, and joints. Strains are stretching or tearing injuries to muscles or tendons. Sprains are tearing injuries to ligaments that hold joints together. Dislocations are the separation of bone ends at a joint. Fractures are breaks in bones. Distinguishing between these types of injuries is often difficult. It is best to treat them all as possible fractures. Common signs of these injuries include swelling, pain, and discoloration.
Bill, do you have a second?
Jan, I don't. I'm late for the operating room. I'll catch you later, okay?
Okay.
Somebody, I need some help. I'm in the stairwell.
The limb may appear deformed, and the person may be guarding it by holding it against his body.
What's wrong?
My shoulder. I felt it pop. It's bad.
Okay, we can help. Just hold it still. Josh.
Unstable bones or joints can damage tissue, muscle, blood vessels, and nerves when moved.
Just hold it still.
The immediate treatment is to minimize movement and prevent additional injury. If the injury seems serious or you are not sure, activate EMS as early as possible. Do not allow the person to use the injured limb. Movement can cause further injury. An open wound may be present in association with a fracture. If needed, expose the injury site by gently cutting or tearing away clothing. Cover an open wound with a clean absorbent pad and gently control bleeding with firm, continuous, direct pressure around the bone or injury site. Never push a bone back under the skin. Leave the injured limb in the position it was found. Use padding in the gaps and holes underneath it to provide a stable and comfortable spot for the limb to rest. If needed, place your hands above and below the injured area to help immobilize the limb. For many injuries, local cooling can help decrease bleeding, swelling, and pain. A plastic bag filled with a mixture of ice and water works best. Place a thin cloth between the bag and skin to prevent cold-related problems. Limit application to 20 minutes or less. Comfort, calm, and reassure the person. Reassess regularly until another provider or EMS personnel take over. Splinting an injured limb can reduce pain and prevent further injury. In general, it is best to rely on EMS personnel to splint, as they have more extensive training, experience, and equipment.